Welcome everyone. In today's video, we will talk about the radiographic evaluation of femoroacetabular impingement. So the radiographic views done for these patients are the anterior posterior view, the frog lateral and the cross table lateral views, the modified Dunn view, which is done with patient supine with hip in 45 degree of flexion, 20 degree of abduction and neutral rotation. Sometimes a false profile view is done with the affected side rotated 65 degree in external rotation. Now let us see the radiographic findings in Cam type impingement. So the first finding is the alpha angle. This is seen in the lateral view and the modified Dunn view. We have already seen how to get the modified Dunn view. Now for this, we first make a best fit circle along the spherical contour of the femoral head, and then we make the angle between two lines. The first line is from the center of the femoral neck to the center of the femoral head, and the second line is from the center of the femoral head to the point on the head neck junction which intersects with this circle, that is the point where the femoral head stops being spherical. So similarly, we draw this in this diagram and we get the alpha angle. Now a normal alpha angle is around 40 to 45 degrees, and an angle greater than 50 to 55 degrees is a Cam deformity. The second parameter is the anterior head-neck offset ratio. So this is seen in the cross table lateral view. It is calculated by dividing the anterior head-neck offset by the diameter of the femoral head. So how do we get this anterior head-neck offset? For this, first we draw a line along the long axis of the femoral neck and then draw two perpendicular lines to this. First from the anterior most portion of the femoral head, and second from the anterior most portion of the femoral neck. The distance between these two lines is the anterior head-neck offset. When we divide this by the diameter of the femoral head, we get the anterior head-neck offset ratio. Now a ratio of less than 0.15 is suggestive of Cam impingement. Next, let us see the findings in Pincer type of impingement or acetabular overcoverage. So let us see the signs of a localized overcoverage. The first sign is the crossover sign. So what is the crossover sign? In a normal AP X-ray, the anterior wall and the posterior wall converge in the supralateral portion of the acetabulum. When there is an anterior overcoverage, the anterior wall crosses in front of the posterior wall in the supralateral part. This is known as the crossover sign. So what does a crossover sign show? A crossover sign shows that the anterior part has an area of overcoverage. Now this overcoverage may be with a normal posterior coverage or a deficient posterior coverage. For this, we see the posterior wall sign. So what is this posterior wall sign? So normally the center of the femoral head lies medial to the posterior wall. If this center lies lateral to the posterior wall, this is known as posterior wall sign, and it indicates that there is a deficient posterior coverage. Now when we have both a crossover sign and a posterior wall sign, this indicates that there is an anterior overcoverage with a deficient posterior overcoverage or a true global retroversion of the acetabulum. The other sign of deficient posterior coverage is the ischial spine sign, in which the ischial spine is more prominent on the ipsilateral side in an otherwise normally rotated X-ray. The next sign is the lateral CE angle of Weiberg. This is also for an anterolateral over coverage. So for this, we make a horizontal line connecting the lower border of the bilateral teardrop. From this, we draw a perpendicular passing through the center of the femoral head, and from the center of the femoral head, we draw a line up to the radiographic sourcil, which is the dense subchondral bone forming the edge of the acetabulum. An angle less than 20 degree is indicative of dysplasia, 20 to 24 degree is borderline dysplasia, and greater than 40 degree is an indication of overcoverage. Now let us see the radiographic signs of global overcoverage. The conditions are Coxa profunda and Protrusio acetabuli. In Coxa profunda, the acetabular fossa lies medial to the ilioischial line, or the lateral border of the teardrop lies medial to this ilioischial line. In a Protrusio acetabuli, the femoral head lies medial to the ilioischial line. So these are the signs of global overcoverage. Now let us see the findings of MRI and MR arthrography. Both these can show us labral tears and articular cartilage damage. However, an MR arthrography is more sensitive. They can pick up labral tears, articular cartilage delamination through tracking of the contrast between the articular cartilage and the subchondral bone. Edema of the anterosuperior femoral neck and acetabulum are some of the early signs of cam impingement. Herniation pits may be seen, which are small cysts in the anterior part of the femoral neck. Sclerosis of the femoral head-neck junction can be seen, and damage to the articular cartilage is a relatively advanced stage. You can also perform the measurement of the alpha angle on the MRI. So friends, this was a video demonstrating the radiographic evaluation of femoroacetabular impingement. If you like these videos, please hit the like button and subscribe to the channel for further videos. Also, comment in the comment section regarding the topics you will like to be covered in the future videos. Thank you.